This is the mandible bone or the lower jaw. It is the largest and the strongest bone of the face. It has one body and two ramus and one body. Now, the body has two surface and two border. Surface, superior border and inferior border. The oblique line is the continuation of the sharp anterior border. Here the sharp anterior border of the ramus. So the oblique line is the continuation of the sharp anterior border of the ramus of the mandible. Now we will see the inner surface of the body. So the inner surface of the body, there is a mylohyoid line which runs downward. Is a prominent ridge that runs obliquely downward and forward. Now, and below the mylohyoid line there is a submandibular fossa in which lodges the submandibular gland. Above the mylohyoid line there is a sublingual fossa. Here the sublingual fossa where the sublingual gland lies. The posterior surface of the symphysis manti has the four small elevation called the superior and inferior genial tubercles. Now, the body has two borders, superior border and inferior border. Superior border, which is also called the alveolar border, bears the socket for the teeth. The inferior border, or the lower border of the mandible, is also called the base. Near the midline, the base show an oval depression, which is also called the digastric fossa. There is a body and the two ramus, then head and neck. The ramus, it is a quadrilateral in shape. It has two surfaces, lateral surface, medial surface, four borders, upper border, lower border, anterior border and the posterior border. It has two processes, coronoid process and the condyloid process. Lateral surface of the ramus it is a flat and bears a number of oblique ridges. In the medial surface of the ramus, there is a mandibular foramen. And there is also a anterior margin of the mandibular foramen marked by a tongue-like shaped projection. It is called the lingula. The upper border of the ramus, it is thin. The lower border is the continuation of the base of the mandible. Anterior border is thin and the posterior border is thick. The coronoid process is flattened and it is triangular upper projection from the anterior superior part of the ramus, and the condylar process, it is a strong upward projection from the posterior superior part of the ramus. It has upward and is expanded from side to side, and it has head and the neck. We will see the muscles of the mandible. So in the lateral surface of the mandible there is a insertion of the masseter. So here is the mental foramen. Below the mental foramen there is a origin of the depressor angularis oris, and here there is a depressor labii inferioris origin of the muscle. Now the incisive fossa gives origin to the mentalis, origin of the mentalis and mentalicis of the orbicularis oris. This is the mylohyoid line. The mylohyoid line gives origin to the mylohyoid muscle. There is a origin of the superior constrictor muscle above the posterior end of the mylohyoid line. Above that there is a muscle of origin of the superior constrictor muscle. Four small elevations of the genial tubercle. So the upper genial tubercle gives origin to the genial glossus muscle, and the lower tubercle gives origin to the geniohyoid muscle. This is the digastric fossa, and the anterior belly of digastric muscle arises from the digastric fossa. This is the lower border, and the platysma is inserted into the lower border. In the lateral surface of the ramus, there is a insertion of the masseter muscle, and now in the medial surface there is a lateral pterygoid insertion, and here is the temporalis insertion, and in the downward there is a medial pterygoid insertion.